Today we're going to be talking about good fat and bad fat. Everybody has those questions. You know, what's the fat that we want to keep? What's the fat that we're going to remove? And so we're going to talk about a couple of things that we can do and what tools we have in our toolbox here at Fayetteville Plastic Surgery that can help you with those decisions. So let's get started. So when we talk about physician-supervised weight loss, we're talking about the fat that's essentially not only just below the skin, as we see right here in this hip area, but also we're talking about the fat that is below the muscle or even in our interthoracic cavity. And so the great thing about using physician-supervised weight loss, it not only shrinks those areas below the skin, but even below the muscle. So there's a whole body shrinkage. There is tightening of the face, there's tightening of the trunk, and even tightening down in some of those tough places as far as where we want to work out. I know plenty of us have been to the gym. I know plenty of us have tried to work out, and essentially what happens is we lose what we call that structural fat, our chest area or in our face, and we just look a little bit gaunt. The great thing about using physician-supervised weight loss when we use HCG is we get to mobilize that storage fat. You know, that fat we just can't run off or just exercise off. And so we're losing this fat inside the thoracic cavity, and we're losing some of that storage fat in those thigh areas. And so that's a great option for us. In this next slide, it'll show you where we have a lady who's actually lost and actually shrank all the way around, and she's generated those great curves that we're looking for. And so this is a great opportunity within about a 40-day time period where we can see a difference. But not only do we get a chance to mobilize some of that storage fat for us to look a little bit better, for those individuals out there that have diabetes, high cholesterol, and hypertension, we see not only a significant number of them actually reduce the amount of medication they're taking, but some of them get rid of all of them totally. It's just a fantastic way to improve your overall health and wellness. So what are the other tools that we have in our toolbox for good fat and bad fat? Well, how about also subtracting or contouring? We have an entity called ThermiTite, and we can use that area not only to melt fat, but also tighten up the skin. So for those tougher areas where we have it in the neck and the jowl, or how about the arms and that kind of flabby arm kind of work no matter how much we exercise. This is even a great compliment for those individuals who already have lost weight that need a little tightening of the tummy area or the cellulite reduction. And that's a fantastic way, once again, with just that small little pinhole like we've talked about in some of our other videos, to once again reshape and just fine-tune what we already have worked so hard for. And this is what it looks like. This is an individual getting a little ThermiTite to her legs, a small pinhole. That area just in that inner thigh area where it's a little bit more of a looser skin. How do we kind of tighten that up a little bit in just one treatment? And as far as the cost, that starts around $3,500. You're adding more areas, we do more cost. In this particular area, we can do the medial, we can do the posterior, around in that what we call that banana roll to lift the bottom, and even those saddlebags as well. The next slide shows just a depiction of that. A lot more smoothness and contour of the thigh areas. Once again, just kind of ironing out some of those places, if you will. This is one of my favorite slides. We show where one of my colleagues just did a little tightening here and a little bit of the fat melting, and of course that brings that sexy back back. Can I say that, sexy back back? Yeah, we can do that. Compared to what we have over here. And of course when that patient went back and filled this in with the tightening, so to speak, it made for a great compliment. Here's the same procedure done in the arms. Once again, tightening of the skin, melting of the fat, just a little pinhole. No scar needed on something like this. Now, one of the biggest questions that I get is, what's the difference between cellulite and fat? Is there a difference? Well, this slide is, I think, fantastic to talk about that. As you can see, a healthy normal tissue has the skin and the dermis, and essentially what we call normal size fat cells. And then we have the deeper fat down here with the vessels. Somebody that has that cellulite appearance of those little hills and valleys like we saw on the other side on the slide has essentially that area just underneath the skin that has been expanded. And these little anchors right here of collagen are not going to move. And so we get that little swelling in between those columns, and that gives us that little hill compared to that attachment point. And then we also have this little deeper fat down here. This is where liposuction, thermy type gets to work on. But essentially right up in here in the cellulite, we have to melt that top layer down. Liposuction does not do well very close to the skin. It may even make the areas a little bit more irregular. So this is where I like using my Thermi Smooth, if you will. Think of it as a nice iron specifically made to improve the appearance of cellulite. It gets down deep enough to take care of the cellulite, to smooth those down, to shrink that little layer, but also get down, in some instances, even down into the deeper fat to melt and contour that as well. And this is just a little cartoon of how it actually works. Once again, a large plate here that allows for deeper penetration, great for the tummy area, great for the thigh, great for those individuals that have even some irregularity after liposuction. A fantastic, as I say, little cellulite iron. And here's a picture of it being done on the arms. Once again, the client does not want any downtime. This procedure takes about a half an hour or less to do, and that's both arms, if you will. And it gives a great opportunity for them to see a result very quickly. In the next one, you can see where we've actually tightened up this area. You can see the fine lines and the appearance. Note when we're comparing it to the second eye, this area right above here has an improvement of lifting of the eye. We can see the lashes come out a little bit more, a nice more opening. And this once again is a compliment to some of your neuromodulators, your Botox, your Dysport, your Xeomin, to not only take out the deeper dents that we see in here, but just smooth out the paint job. Now, this is a great slide where we talk about what are those areas of liposuction that we want to consider. And as you can see, these are once again those storage areas that are really tough for us to exercise off. And this is where we can make a difference in those areas very specifically using liposuction with usually just one treatment. Here's a great depiction of liposculpting. So not only did we contour here and even take care of some of the fat there, but now you can see we've even etched right over top of that six-pack. It defines it a little bit more. It gives us the hills and valleys that we want to see in this particular area and gives them a really nice look, of course, come beach time. For those gentlemen who suffer from gynecomastia, a little bit of extra glandular tissue, we can use a combination of liposuction and removing that glandular tissue to once again give them a little bit more confidence as well, with or without their shirt. And what about fat transfer? Now, we can take fat that we remove from liposuction and just throw it away, or we can use that to enhance some of the curves. So in this depiction, we can take fat from the buttocks or the hip area and put it in the breast tissue. This allows us to, let's say, a B cup to go to a full C, an A to go to a B. But once again, it gives us another option versus a lift or an implant, depending on what your anatomy shows us. This is just a small depiction of actually putting the fat right on the chest wall to give the breast a little bit more projection and volume. And here's a simple picture once again showing the contour, if you will, with the fat transfer. Now, what's happening as we mature? This slide shows that when a person is in their 30s, we have a nice amount of insulation right in here. A nice full face with great fat. Not too much, not too little. But it's that fat that gives us the softness, the highlights on the skin that gives us a much more youthful look. As you see, as we continue to mature in our 40s, we start to lose some of those small pockets. And therefore the balloon gets a little bit deflated. And of course, as we continue in our 50s, we can see that the less fat that's there basically shows some of those irregularities of the muscle that's underneath. And so if we can turn back the hand of time by taking some of that fat and moving it back towards here, it's once again a much more youthful look. Here's just a depiction of once again where we lose and see some of the hollowness here. We see more of our angry lines because we've lost some of that insulation and starting to see a little bit more of the jowling. Here's a patient that got nothing but fat transfer. We filled in the hollowness here along the nasolabial fold, and we put a little bit in her lips too. So once again, a much more vibrant, a much more youthful look without any cutting, just enhancing with fat transfer. There is no question that we want the hands to match the face. Essentially, this is a tough area for women to control as far as having them look a little bit more mature than they want to. So if we're doing some liposculpting around the tummy, we can fill that in with the hand. That'll last several years. Some people get a great result. I usually tell people when they ask me, well, how long will it last? I say, well, you've had a long-term relationship with your fat in the past, so why not use it in somewhere that'll soften that up? And this is the infamous Brazilian butt lift. This is about taking fat from those areas that we want to smooth down, or in this area right here, and we can get a little bit more volume and lift. Once again, the confidence that the client feels in their clothes. These are the different shapes. Once again, it's a cultural choice. It is a matter of personal preference, where we want to put the fat and, more importantly, the end results. So during the consultations, this is when we talk about where we want to put the fat, why we want to put the fat there to give you your ultimate result. Here's once again a real-time depiction, and as we see here, it is not about the butt with the Brazilian butt lift. It's actually about the waist. We want to see how much more contoured this is and soften up the little curves, at least in this particular client. And once again, she feels very confident in her clothes, and she has the profile and the silhouette that she wants to show. And of course, we have a great opportunity here at Fayetteville Plastic Surgery to do it in all a private setting. It's concierge service. We are AAA-HC certified, and we're very proud of that. So once again, that's good fat and bad fat in about 10 minutes. I hope you learned something, and I hope to see you soon.